So, just continuing on from what we said, this is osteochondritis of the metacarpal metatarsophalangeal joint. So one way you can observe it is, okay, so what it says is dorsal 30 degrees. So the front part of the hoof is 30 degrees. The proximal part is 70, what? Is 70 degrees. Okay, just read this. Lateral palmar distal medial oblique radiographic view. What? Basically this view of the metacarpophalangeal joint. Okay, so it shows different bones as well. So A shows you the third metacarpal bone. This is the proximal phalanx. C is the medial proximal sesamoid bone. And D is the lateral proximal sesamoid bone. So C is medial, D is lateral. You also have the dorsal 45 degree proximal 45 degree lateral palmar distal, I can't read this, view, and yeah, it shows you the same bone. So just to recap, third metacarpal bone, proximal sesamoid bone, this is the medial proximal sesamoid bone, and this is the lateral. Yeah, I'm not sure if this is entirely relevant, if I'm being totally honest, but I just don't want anyone to get caught out. This shows you an osteochondritis fragment on the lateral plantar eminence of the P1, so that's the first phalanx. The avulsion fracture, this shows you an avulsion fracture of the palmar side of phalanx 1. Treatment. Okay, so treatment can be conservative. So it's only very successful in very young animals, by the way, because they have a good capacity for regeneration. In very mild cases, so let's say if the case is less than 2 centimeters long and less than 5 millimeters deep, so just remember those numbers, the regenerative capacity of growing cartilage is very narrow. So it's 5 months for TC, metacarpal and metatarsal joints, and 8 months for FP joints. I'm sorry, I don't remember. But yeah, basically, just focus here. Rest, controlled exercise, nutrition, so decreased carbs but increased copper, NSAIDs, and cartilage modifying drugs. And yeah, they've just shown some examples. So you have NSAIDs like phenylbutazone, flunixin, meglumine, which is like a favorite in horses, inarticular steroids like methylprednisolone, betamethasone, inarticular chondroprotective drugs, so hyaluronic acid, for example, which is a component of cartilage anyway, systemic chondroprotective drugs, so chondroitin sulfate in the form of adequan, oral supplementation with glucosamine, hyaluronan, and also, have you noticed it also says copper here, which is helpful. But yeah, you can do an arthroscopic debridement, so that's a sexy horses like that. So how does it work? So you have, you can see through the arthroscopy, you can see the view of osteochondritis dissecans, and I believe this must be the cartilage flap, and it's on the lateral trochlear ridge of the femur before probing with this. And A, so this picture shows elevation of the osteochondritis dissecans flap. Sorry, I haven't eaten. Then you have B, which shows you debridement of the osteochondritic tissue. So next, we're going to move on to subchondral cystic lesions. So a lot of this is all just like, I'm not skipping anything. A lot of it is just other diseases. So SCLs, so these lesions, what are they? So it's a developmental disease. What you have is round bone cavities, so holes, with thin areas with a myxomatous tissue with or without fluid that looks normal or slightly bloody, like synovial fluid, and it's inflammatory as well. It's usually in subchondral bone under the articular cartilage in a weight-bearing area of the joint, and this is usually found in the metaphysis or close to the growth plate, and they have typical predilection sites in bones, so mostly medial femoral condyles, then phalanges, navicular bones, carpal bones, metacarpal, metatarsal bones. Simeonova has done something considerate, and she's put them in order. So anyway, causes. So you have the hydraulic theory. So this is where you have cartilage damage followed by intrusion of the synovial fluid because of that damage. And yeah, apparently the hydraulic theory is based on the idea that the fluid affects the mechanical pressure of the subchondral bone because it has hydraulic action. Their words. The inflammatory theory is based on the idea that bone trauma results in secondary subchondral necrosis, which leads to inflammation. And with inflammation, you get activation of osteoclasts. So these are cells that are meant to break down bones. And this results in bone resorption and inflammation. We'll stop here for clinical signs.